Can I tell you 3 things to help you with that hip pain that you have coming from a women's health physical therapist? If you don't know, I'm Dr. Wendy. I'm a physical therapist and I take care of women. And here's the thing, hip pain happens. It's not if, it is when. Hip pain is going to happen to you. I need you to know what to do when it happens to you. First off, if you are a woman who is in menopause, odds are good you're stiff. So here's the thing that we have to think about for you. We need to think about your mobility, which is moving your joint through the whole range. Then we can think about stretching, which is the muscle. And then we need to think about strengthening. Now, technically speaking, that stretching and mobility is the same. So let's put that together. Let's talk about strengthening. And then third, let's talk about recovery, being good to your body. So if I were to put together a generalized plan for people with hip pain, number one, it would be doing 5 to 10 minutes of mobility a day and or stretching. Sometimes that can look like sun salutations. Number two, it would be lifting 3 times a week or doing strengthening like PT exercises. I do a lot of the basic straight leg raises. I do side planks, clamshells. I talk about that all the time. So if you can't lift, you can do those or you can do both. And the third thing I would recommend would be self-care activities such as a massage gun, cupping, gua sha. Some people like to do foam rollers. Maybe you actually take an Epsom salt bath. Maybe you apply an ice pack because your pain's so bad you need to get it under control. Maybe you apply a heating pad because that muscle's so tight. I need you to know that you might need to put a little more effort into that self-care to help the recovery because we're just not as elastic and pliable in the menopause transition. Now, if you are postpartum, your hip pain looks different because your hormones are all over and you're a little more loose. So you might need something like strengthening with maybe some stabilization exercises. You might need to be wearing shoes inside your house because you need more stability from the ground up because now you're really loose. You might even have to wear something like an SI belt to help give your pelvis stability while we wait for you to heal. So where you are in life determines what exercises you do. But almost always will there be strengthening. Almost always will there be that self-care. Sometimes though, we need to stretch more if you're stiffer. Sometimes we need to stabilize more if you are weaker or postpartum. But like there's always something. And I need you to understand it's not if this is going to happen to me, it's when. And when it does, I want you to know what to do. Love you, bye.